Good afternoon, everyone, and welcome to Vital Signs. Vital Signs is Sunstar Cebu's health and wellness program in collaboration with the Cebu provincial government. I'm Mildred Galarpe. Today, we shed light on the critical public health program, HIV, with a special focus on pediatrics. Despite advances in medicine and awareness, HIV continues to affect individuals and families, including children who face unique challenges in prevention, diagnosis, and treatment. Understanding how HIV impacts both adults and young patients is key to promoting early detection, proper management, and stigma-free approach to care. To help us navigate the important discussion, we are honored to have with us Dr. Kathleen Joyce, Kitkat del Carmen, a dedicated pediatrician who is she works at the HIV/AIDS core team at the Kaambag Hub or an HIV hub at the Vicente Soto Memorial Medical Center. She also is a consultant on postgraduate internship monitor at the Department of Pediatrics, team lead of research contests, research committee at the Chonghua Hospital, Mandaue. Doc Kitkat is also a professor at the Department of Pediatrics, Department of Biochemistry and Physiology at the Gulyas College of Medicine. Doc Kitkat finished her Doctor of Medicine at the Cebu Institute of Medicine, Batch 2017, and finished her Masters of Arts in Health Professions Education at the Xavier University Ateneo de Cagayan in 2024. So, Doc Kitkat, good afternoon. Mura chocolate ang mo register sa kung huna-huna sa KitKat oy. Doc, maayong hapon.
Maayong hapon, Ma'am Mildred and sa tanan nga naminaw nato karon hapon.
Okay, so very interesting nga topic on HIV. Kay ang kultura sa Pilipinas is it's kind of taboo to discuss about this mga premarital or extra anak majority
Yes.
of
Associated
transmission
siya
associated man gid siya
a
on
certain stigma.
stigma.
Yes.
So before we proceed, can you just balik lang ta sa basic, what is HIV?
So HIV or the HIV virus isa na siya kagaw no or virus gyud nga mo'y nakakos sa AIDS. Okay? So ang HIV ang virus, ang AIDS ang sakit.
Okay.
So it's a spectrum. Kani nga virus or kagaw sa atong lawas makuha ni nato mas commonly through sex gyud, no? It's a sexually transmitted infection. And then, however, a lot of people don't know that it could also be transmitted through other means, such as through IV, no?
Which is also
When
common
you-
in Cebu.
Yes, when you do drugs, no? IV, specifically IV drug use. Also, if the mother is infected, the mother can transmit vertically to her baby through three things. During her pregnancy, no? When there is circulation of your uteroplacental fluids, during labor, when, example, they are delivered vaginally and then they are exposed to the blood of the mother and they go to the mucosa or the eyes or they swallow something in the mouth or whatever the fluids there is, no? Because basically they're in the fluids. And also through breastfeeding postpartum. So fluids, the exchange of body fluids to the body. Yes.
So is it also possible nga naaside kanang from mother to conscious na taba nga ang mother is infected, naabay instances in a way nga paggawa sa bata HIV free ra siya?
Yes.
Oh, okay.
Yes. So we have that now. There are mothers who have babies na actually negative. So how do they do that? First, they have to know that they are positive. Because when they are positive, they can take necessary the meds. Usually, their transmission rate decreases to as low as less than 1%.
Okay.
When they took their medications, what we call the ART or the antiretroviral therapy, at least 4 weeks before delivery. Okay. And if their viral load or meaning kataas sa virus ilang lawas is actually less than 1,000 copies per ml. So when we have those then their viral load is undetected, no, when they are compliant to their medications, the risk is so low, less than 1%. And so when we test the baby, we test them at 4 weeks or 1 month old, and then we test them again at 4 months old, and the last test is at 18 months old, which is the antibody test. And that's when we graduate them from the Kaambag program, where they are monitored as they are HIV exposed infants. So they are called HIV exposed infants.
Okay.
Yes. Automatic if the mother has HIV. Whether the mother is diagnosed prenatally, during labor, even postnatal.
Postnatal.
Yes. Especially if that she doesn't know. So it is really our sort of we really want to get them tested. So a lot of before, the practice is when they give birth to lying centers, no, sometimes they don't have the test ba
Yes, wala.
diba?
Oo.
Wala. So kasagaran na sa mga hospitals gyud, no. So we want to push that part of the prenatal care, part of the prenatal tests that mother get is HIV, because there is something we can do to prevent the mother-to-child transmission. And what we call that the PMTCT, or prevention of mother-to-child transmission. And this happens when we know that the mother is positive, she's taking her meds, and so therefore this baby who is now an exposed infant could also take a prophylaxis nga tambal to prevent
The
HIV. Okay, because HIV can be prevented now.
Oh.
Yes.
So, nanay tambal.
Yes. So aside from the treatment
Yeah.
itself, meaning you already have the virus,
virus.
no, so you are treated with the ARD. But if you are negative, no, but you are high risk for exposure, for example, infants who have mothers who are positive, or if you have a partner even, no, na positive siya and ikaw dili. So you can take, okay, let's talk first about the adult. Okay, for the adults, if you want to protect yourself, there is such a thing as pre-exposure prophylaxis. Okay, we call it PrEP. It's available now. No, it's most specifically this year. No, this is an oral medication taken before you get exposed. So, assuming you have a high-risk behavior, no, you don't know when you'll get exposed, no. So, you can take something para ma-protect na ka. Now, in case something happened, whatever the circumstances were, you can also take a post-exposure prophylaxis.
Oh,
Okay, so before and after.
Even if naanak ka, nanay treatment for that. Di na katong just inom lang ka ato, but you are forever maging ana.
Yes, kay we have partners, no. Of course, eventually, if they want to get married, they want to have kids, but they got HIV at an earlier age. So, but their partner is negative. So their partner, of course, they are married. They will do this. They will do sexual intercourse, and so there is a way to protect the partner who is negative.
Katong negative.
Yes,
Okay.
she can take the prophylaxis to avoid getting the HIV virus.
Pero katong na positive na ba siya treatment?
Okay. Yes, there is a treatment to control the virus,
Oh.
but not to cure it. At this
It's
point,
part
wala
of
pa
the
tayo na technology for a cure.
So kanang regular nila nga
Yes.
medicine, that is to control for further progression.
Yes, to
Okay.
avoid the disease, the AIDS, the
The
acquired
acquired
immunodeficiency
immunodeficiency
syndrome. Yes.
Okay, so murag katong mga partners nga tan-aw ninyo murag wa gyud tay mabuhat sa pagka high profile sa imong usa ka partner, managang na lang ka, or I mean whether or unsa inyong partners, mas better gyud na gyud kay regular check sa
Yes.
imong self, no, kay wa man ta kabalo.
Yes. Marag di ta kabaw kung binuangan ta or unsa na ay
And
lain.
then you get a sickness nga wala kay
Yes.
gibuhat. So
Yes.
yeah, I think it's more practical now to be more proactive imong
Yes.
thinking to protect yourself, especially if naa ka sa age of childbearing, di ba?
Yes,
Oo.
yes, because statistics show that there is an increasing trend of pregnant mothers who are actually positive or living with HIV. So I think awareness is key, that when you already engage in sexual activity, you have to get tested. Okay, of course, we want to trust our partners, but we also want to empower ourselves to be
Keep
the
protected.
leader of our own health. Now, going back for the infants naman,
Yes.
so earlier, if you have a partner, right, you can take a PrEP, no, pre-exposure, or a post-exposure, a PEP. For infants, there is also a prophylaxis.
Okay.
We call it the HIV infant prophylaxis. Okay, they take it 6 to 12 weeks medication until we test them for HIV. Okay.
Kani nga mga medications and everything available can government provide this for free or for a fee?
Okay. So the good news
Yeah.
is it's free.
Okay.
Absolutely free.
So moadto ra gyud ka sa in town kanang
Yes.
kung naakay mga pagduda, I think ang office ni Doc Kitkat naa sa Vicente Soto, pangitaa lang ang kaambag nga opisina. Maybe, I mean, you can seek help there.
Yes.
Good if negative, but at least you have yourself tested.
Yes, we offer, actually any hub, we offer this free HIV testing and counseling, and also the medications.
How many hubs do we have again?
The total number of hubs is available online. You can search it, the DOH HIV hubs, and it's categorized per region. So specifically for Region 7, we have 20 hubs, both in public and private hospitals. So for public hospitals, we have, of course,
Sumuadto lang sila, Doc.
PSMMC.
Even if in private, they can still
Yes.
kanang there's a free service.
Yes, it's free
Okay.
service.
Doc, do we have a figure og kumusta man sad ang HIV picture for Central Visayas or for Cebu for that matter
Okay.
compared to like previous years?
Okay, so our data is from it's a compilation, no, from, you have the UNAIDS, you have the WHO, and for the past years, ang ilang recent data is the 2024, and they recorded so far as of 2024 a total of 40.8 million people worldwide are living with HIV. And of that 40.8 million, the women is 21 million.
So more than men?
Sorry. The adults is 39.4, and of the adults, 21 are women and 18.5 million are men.
Tinagi na siya fair. Anong mas dagan ang men? Ang gamay ang men net. Anong dagan ang babayi? Sige. Okay, Doc.
For this census,
Yes.
it's true. Nas daghan ang girls, ang women, no? Usually 15 years and above. 21 million na sila. So, it's alarming because they are childbearing.
Yes.
And therefore, they can also pass it down
Mas
to
mo
their
double
children.
ang transmission, di ba? Ang chance of transmission ba?
You
no?
have your transmission through sex, and also vertically when you are pregnant,
oo.
or breastfeeding.
Yes.
And then for the children, it's approximately 1.4 million. Now, although this is a smaller percentage compared to the entire population, but still there is something we can do man good. Kay sayang ang ma-prevent katong atong ginatawag nga prophylaxis. Kay pwede gid unta ma-negative ang baby even if positive ang mother. Yes.
So naagid nagay chance to protect your baby if aware lang gyud ka, no? I mean, even para siguro bisan siguro kanang for ako managang na lang gyud ka, no? Managang na lang gyud whatever it is,
Yes.
managang na lang, and dealt with the discussions later with better be safe than sorry. So
Yes.
what about the Philippines?
So,
Unsa man pud ang figures
ang
sa
figures.
Philippines, Doc?
So currently our data is from, of course, the OH, and also in line with the UNAIDS 2023 data. So from globally na almost 40 million, no. In the Asia Pacific, it's around 6.7 million, and in the Philippines, we have a total of 189,000. So this is as of 2023. Now, but if you can see from the previous years, this is actually a 550% increase.
Ang 2023 nga data.
Yes, ang 2023 nga data. Okay? So gabi, it's an alarming na it's high gyud.
Pero
But
what triggered this increase? Is it because there is more documentation and more testing now compared to before?
um fortunately, because of the testing,
Oo.
I think that's because of the rise also. It affects the increasing trend in HIV, most likely because there is more testing. And I think I'm happy that maybe people are more open to this
This
now
now.
to test them. It's a lot of hospitals are part of their protocols for pregnant women. They already incorporate HIV testing,
testing, oo.
with the first prenatal visit.
So murag dako man tuod ang number pero mahibaw-an nimo so ma-address nimo, di ba?
Yes.
Murag walang pud na siya I don't know if it's a good side but kanang ma-address and then precautions can be considered before further infecting other people,
Yes.
right?
Because of their more testing, and therefore daghan pud makatch gyud.
And interventions, no?
And interventions. Malink to care sila.
Yeah, okay. Kanilang sa day atong i-klaro if those who are watching kanang kung unsure mo kanang wala gina it's better be safe than sorry. Pwede ra kita mo adto Soto, have ourselves tested, and para there will be early intervention kaysa imo lang ipalabay when in fact there is already government intervention on this aspect. Pero for Cebu City, katong 500% increase, that's even for the global or just for the Philippines?
That's for the Philippines.
Okay, that's for the
Sorry for my
Philippines. Nganong kumusta man sad ang pediatric infection, Doc? I mean, unsa man pila man ka percent ani ang unsa gani ang age considered pedia?
We treat the pediatric population less than 19 years old.
So 19 below.
Below.
Okay.
Or technically 18 years and 364 days.
1 year,
Sorry
1 year
for my
old, no?
voice.
1 year old. So,
Yeah.
kani siyang katong masabtan to na to ang babies, Doc, kay gikan wa mo gid sila nabuhat ato kay gikan man to sa ilahang mama nga transmission. What about unsa man ang other kanang edad nga ang pinaka early or pinaka young nga pediatric patient nato for HIV so far?
Okay. I can only speak for our own hub.
Above, oo.
We have positive babies as early as neonates. So, pagawas gyud.
But this is because ilang mom is
Yes.
infected. But what about those kanang
Okay. So, we have pediatric patients. If you're talking about the transmission through the mother, it's as early as the baby. But if transmission through sex, in Cebu, our youngest is 15.
unsa yung grade
15 years
unsa yung
old.
grade sa 15? Grade what? Grade 7? Grade 7.
Grade 7.
Duwa man kung batulata ani Doc.
Yes. Based on history, their first sexual encounter is usually 12 years old. So as early as that, they would experiment already. So it's an alarming way of knowing na
As early as this age
as
na
early
anay
as 11 to 12 years
years
old, they are experimenting already.
okay.
Because maybe, of course, social media
Media.
or pressure or not really talking about it at home.
Because it's a taboo.
Yes.
Because nobody wants to talk about it. Tinuod gid ni kanang a mother myself, I think kita karon mga mama no in the new generation, we need to be more open to our children in terms of discussions ngayon ani. Wala ka nag-ingon, nag-encourage mo na kala sige pag-apil-apil dito dili, but to guide them to keep in their mind na if mo go ka to that level, make sure to protect yourself. Kanang di man gyud na nimo wala man ka nagbutang og tracker sa imong anak kung unsay iyang buhaton the whole day, but I think that's the more sensible thing to educate your children. Kana bang dili ba ta let's call red not other colors, kanang part of education gyud na siya. What do you think about ani Doc?
You know, there is a 100% solution
Okay.
nga would produce a 100% avoidance yun or abstinence.
Oh yes. Mo gina.
Mo gyud na ang
Ayaw gyud.
pinaka-effective
Effective, yes.
before the
The
treatment, before the prophylaxis. It's really abstinence
Yes.
for before you get married and you stick to one person.
Son. Oh.
Mo gyud na. So when you but of course since if this already happened for whatever circumstances, there are ways to protect themselves, no? And they should know about this as early as the point that they can understand what sex is, what HIV is, what having that virus is.
Do we need to, explain this more in the schools? I mean, naaba ni sa atong Juve, naaba ni sa atong eskwelahan? Is this being explained by the teachers? Unsa ni siya nga
It's
mga
actually a
butang?
good point, no? Because in our hub, of course, we do HIV 101, but
Yes.
usually it's for those who are positive already or their families, no? But I'm not sure around in the school setting, no, if it's already being talked about. But I think maybe by doing so, this, no, mga interviews like this, we can have our presence na, this awareness where HIV is really, it's here, and it's increasing, that we can probably start conversations so that people could take steps to protect themselves.
And it's a virus that can be avoided.
Yes.
Nya usa ra gyud gisulti ni doc nga 100 mo lagi na 100%
Ang 100% effective is abstinence.
Ayaw gyud.
Yes.
Nya kung pwede na ka mobuhat ana, stick to one.
Silang duha.
Silang
Stick to
duha,
one.
di na kay usa lang. So
Yes.
kana siya doc. What is the current status of pediatric HIV infections for pediatric in the Philippines, and how does it compare to previous years?
Okay, so for pediatric, so currently o globally, we are experiencing mga 1.2 to 2 million estimate of pediatric age living with HIV. Because of course less than 19 is still considered koan man pedia. They actually divided manggod ang census na less than 15 or more than 15, and that is because usually more than 15 they have their own consent naman good. So if you're basing it with the entire pediatric including the 19 and below, okay, that would estimate to 2.4. Okay, and of that 2.4 million, actually 57% are between the age group of 0 to 14 years old.
57.
Yes, 57%. And then 50% of children born with HIV, usually they die before their second birthday if no treatment.
Kaya wala na hibaw. Possible po na
Yes.
nawa na detect. So
Wala na-detect. And of course, it starts with the mother. So, if the mother doesn't know until there is clinical apparent illness, wala po nato na-treat ang bata. Okay. And then, 12% of AIDS-related deaths occur in children. Even if the small population lang sila, but the
Is
mortality
dako.
is high. Oo. So, of course, a lot of interplay with malnutrition, of course, no, there's their circumstances, but it's really high morbidity and high mortality in the pediatric age group.
kanang naay data dinhi katong mapakita ni nato kanang Eric kaning monthly census bitaw nga there are 1,373 alive on ART. So kani siya as of September 25, 2025. Pero unsay for the month lang ni siya Doc, or
For the as of September's na currently our patients,
pero unsa from what period to
from what period? I'll check. It's from January 1984
To
the
the current period?
current period.
Kaning atong under ART wala pa pila kuan ani niya ang like ni progress good to AIDS or namatay gud sila or what?
Okay.
Alive maning 1373
Alive, yes.
pero
But currently, oo. So, kani sila ang data nato nga monthly census. You usually update it for those who want to keep updated of the census. We posted it in our VSMMC Facebook page, official page, and also in our Kaambag Facebook page. So this is the latest census of September 2025, and as you can see, we have a total of those we are
treating right now with the positive na gid ni sila, they are alive. They are total of 1,373. And of those 1,373, 11%, no? Sa Cebu nga census, sa amo ang hub, it's 11% ang females, 89% ang males. Oh, and our local setting. And you can see also in the census, there are 11 of which kay pregnant.
Yes.
Yes, and then 77%, see, the key population
Nation is-
here,
yeah.
the highest
Yes. MSM.
is the MSM, the men having sex with men. And like we said earlier, they have their first sexual encounters at an earlier age now. So since 12 is still pediatric age group, no? This age group, this 15, 16 years old who engage in sex, and they are here, they are in the key population
Nations.
na taas.
Taas na
Oo.
sila at this rate,
Na-contribute sila
So,
ani.
oo.
So there are also pediatric patients who are MSMs.
So, okay. So, for example, you get tested, you're positive. What will happen next?
Okay, if you're tested and you're positive, we have a test called screening pa. Okay, screening is the one we do when we do opt-out testing. No, the one you receive the results within the day or the next day. Once we have the screening positive, we clinically consider them as positive na. But we of course tested them for the confirmatory. Okay, so fortunately, BSMMC is a DOH accredited RIVDA testing center, and that is the confirmatory. Okay, aside from the ones in Luzon, which is the San Lazaro and the RITM. So for confirmatory, it's really for the Visayas, it's BSMMC. Now once they are even so screening positive, we link them to a HIV hub. So, unsay duol nila, if they are in Mandaue, if they are in Cebu, Talisay, so there are specific hubs for that area. And then, once we link them to the area, they will be tested for other opportunistic infections because you have to treat also sexually transmitted infections like syphilis, no? We test them for that. And then, we start them on the ART, antiretroviral therapy. Okay, and then, of course, we follow them up. Usually, if they are newly diagnosed, of course, mas frequent ang follow-up because we're monitoring side effects. The good news is the meds nowadays, the ones we have, the preferred regimen as per WHO, as per DOH, is what we call the LTD, or the lamivudine, tenofovir, dolutegravir regimen. And this is only a 1 tablet once a day. Mura siyag vitamins. And compared to the previous regimens years before, this has a lesser side effect. No? Almost, wala mi kaayo, wala mi
Na-monitor
report
na.
nga. Even if we monitor them, wala mi serious side effects good ani nila. No, just the occasional kuan hilab sa tiyan, but a lot of times they subside. And so they have their consults every 2 weeks or monthly for the first 6 months, and then we repeat the baseline labs that we get. So of course we get the CD4. The CD4 is a marker of how strong your immune system is. So we want it to be high. And then we also have a baseline of viral load to check this is in the pediatric group now, to check their virus, the level of virus in their blood. So that is your viral load. And then we compare it 6 months after treatment. And then once they improve, especially with good compliance, mo abot na din every 3 months na ang follow-up. And then, a lot of times, if they are what we call undetected or virally suppressed, no, it's so low that the laboratory cannot detect it. But of course, it's still in the system. We know that. Kaya di man na mawala. It's just really makontrol. So when it's undetected, usually it's once a year or twice a year na
Ang
lang.
pagbalik.
Yes, just for monitoring lang.
For all these labs and everything, libre ra gyapon ni siya sa suko.
Yes, they're free.
Yes.
For us, aside from the the HIV test, no, the CD4 viral load, if you have a concomitant infections, even if you have comorbidities, hypertension, diabetes,
Diabetes.
if you are under our hub, and of course, as a tertiary hospital, public tertiary hospital, it's also free. Yes.
Okay. So, may na kayo siya nga,
I-avail yun.
may nagid kayo siya nga mga developments, especially may kanang in fairness maayo biya gyud ang expansion sa Vicente Soto karon. So, murag congratulations to Dr. Aquino kay, di ba, we have already daghan na ang Soto, we have a cancer center and pa ni ang HIV hub. So,
Yes.
di na ta mistil mularga pag Manila because it's
Yes.
already here. Just pwede ra gyud kung nakadiri sa Sunstar, pwede ra gyud nimo lakwon padung dito. Pareha ni Publio Briones nga magsigig jogging all the way. Pwede ra gyud ninyo lakwon. So I
Yes.
think this is good news nga kanang di ta maguol magpatambal kay wa tay kwarta because government is providing it for free.
Yes, and also we are thankful that our presence is more palpable in a way that since Governor Barry
Cuatro.
Cuatro had the medical missions, no, prior to, of course, the
The
earthquake.
earthquake, yes.
So we were part, HIV testing was part of
Katong sa mga
yes,
katong mga
moadto sa-
medical mission in the
yes, sa Danao,
countryside.
sa Karkar, yes. So we empower kuan man people to get tested. So we are also offering our services through these medical missions also. And thank you for the invite.
Yes.
And right now people are more kanang open for testing. So if you will have a surgery for an elective or kuan nga surgery, they also usually test na, no, with the consent of the patient. So at least mas kabalos din baka protekta sa to self, di ba? So
Pero sakto na kay sa katubitang during sa COVID di ka pwede operahan or any procedure og di ka mag COVID test, di ka
yeah.
So mo I think
Maring
kuan
ana
pud ni
ra
siya.
pod.
I think safe ra pud nga mag HIV test ka kay dugo man gud siya, di ba,
Yes.
to protect you and also the people nga mo
yes.
mo handle nimo.
Yes.
So protection gina siya sa everybody mga higala. So kani siya doc naa naman ta aning mga government services, no? But what about supporting HIV prevention, treatment and education specifically for children and the young adults, the younger adults, dili prang Kenneth, the older adult.
Yes. In Kaambag, we do have our platform. We call it Teach Cebu. It's via Facebook Live. So every Thursday,
Regular na siya nga
yes,
okay.
it's a regular webinar program every Thursday 7 p.m. via our Teach Cebu Facebook that we go on live to address certain key topics related to HIV. Everything related to HIV.
Pwede ra gyud mo na i-share sa among Facebook page sa
Yes,
Sansar Cebu
yes.
para ma-widen na to ang pagpahibaw kalabot aning HIV kay nagkadako ra ba gyud in town ang ihang numbers wa ba siya
Yes.
nagkagamay. So think mas maayo madaghan ang makahibaw, mas daghan ang makapangandam, daghan makaprevent ani. So that's on your Facebook page.
Yes, on the
Okay.
Teach Cebu Facebook page.
Okay. On the other hand, unsa man sad ang challenges do healthcare providers face on diagnosing and managing pediatric HIV cases?
Okay, specifically for pediatric PLHIV,
Yes.
because I'm the pediatrician, a lot of this key population has really certain stories, backstories
Backstories.
that, some were abused, some were, nga na, no? So, a lot of, there are times that it's not really their fault, no? Or their mother
Victims of circumstances,
Yes, victims of circumstances. So, we also refer them to social workers and even the SWD. And then, I think for me, the challenge is really disclosure also to this population when their understanding is still, their maturity is still developing pa. Do they really understand this na? So especially for the children who have HIV at a young age, when they, for example, they got it from their mother at an early age, so they were already they're taking medications thinking it is vitamins because they don't know infection yet, they don't know maintenance. And at a certain age, usually when we transition them to an adolescent, no, usually 10 years old above, they will now question why are they still taking these vitamins or these medications, although some of them naanad na. But then when they start to question, then of course this disclosure process is one of the more challenging aspect in handling these cases.
Is acceptance.
Yes, that they got it, they have all the virus, they have to take their medications until as a maintenance.
Yes,
yeah.
until there is such a
Cure.
treatment, a cure.
A cure.
Pero what unsay pasabot Doc, if you're a pediatric ka nga na HIV, does that mean that kanang carrier ka, you can makatakod ka?
Yes, of course. More nanagid ka HIV, you have the virus.
Okay.
Whether how you ever got it, whether it was vertically transmitted to you or through sex or through IV. Yes, we should. That's why when we educate them, we have to also educate them about how they could prevent transmitting it to others. Kay they already have it. So when you, of course, we advocate for again abstinence, no. But for those who are desiring family, no, aside from the prophylaxis that their partners can take, we still encourage them barrier methods. We give condoms, we provide lubricants to really discourage kanang prevent blood, no, or fluid
Contact.
Yes, contact.
Okay.
Oo.
Kaguol ba di ay net uy? Kung ako'y naguol kanang yes ma-stop ang progression, but murag mura ba siya
Naanagid
yeah,
siya.
kanang unsa gyud nang magsakit sa tiyan kanang amoebiasis. Di ba mo siya, di ba nga kanang murag the ano is there? Sakto ba na Doc?
Ang amoeba na ay pwede mo stay
Yes.
sa liver, mag-abscess dito.
Gamayng trigger.
Pero
ano,
treatable.
yes,
Pero
yeah.
kani, mo
Dili
na,
man, no?
kanang dili siya, wala siya cure, but it's treatable in a way that you can live long and healthy life. So,
Mo lang gid na.
Kana.
Career na lang gid ta. So
Career
maningkamot
na.
ta for katong mga naaani to be more conscious and to be more responsible sa atong mga decisions, atong actions kay mas risk ta to other people.
Yes.
Okay. So, how has the 2018 HIV law impacted access to HIV services for minors?
okay, a lot, of course, the access to treatment, to medications is more open now. So, for those who are 15 years old and above, we actually offer the PrEP to this population na. Not specific for that, no. And also, since na naman sila buot, they can go to the hub by themselves. So dili na sila kailangan mo adto pod with their parents. No, sometimes usually mga 18 sila na lang. Although we encourage na you can tell your parents, so you have a support system, but it's their kanang choice kung moingon sila or dili. And also kaning dili lang medication nga support ang naana. We give referrals to if naa sila problema with abuse, substance abuse, even kanang mental health issues kani nga age group na ay psychiatry, even part of the group or the team. Yes. For us in Kaambag, we have that. And also even for referrals from other HIV hubs nga for certain kanang multidisciplinary care, we call it intensive case management na. So we assign we have a case manager who follows them up. We even have an own group chat with them. They have their social media account, and then a case manager, a doctor, social worker, and their nurse. So para di gid sila mawala.
Naabay ang like for example kanang mga alcoholics, they have mga
Okay.
clubs. Do they also have that wherein they among themselves can share their experiences, learn from each other?
Okay, so sa Pedia, we have a monthly women living with HIV support group
Oh.
with a kanang drawing activity for their children. It's end of Saturday of the month at Kaambag. So it is also in partnership with the organization called Glory Reborn. It is also their advocacy to support women. So to empower them. Although specific support groups for alcohol, it's probably different kanang support group, but we can channel them to the support groups that we have already. But for the pedia and women, we have it every end Saturday of the month.
How long has been Kaambag in existence sa Soto?
Okay. Kaambag has been in VSMMC since 2009 when VSMMC employees were trained by the DOH Central Office for HIV treatment. There is a training that those under the hub underwent, no? And then since then, in 2009, and that is more than pila na ka years.
7?
2009.
Oh, no, sorry. 2019 may nigawas akong una-una.
2009.
10 ang 2019 plus siguro mga 17, 16 years.
Mga anak na. So,
okay.
we've been, it started from a small pang hub, and then now it has grown into a multi-specialty type of hub. So, for example, because HIV is not just HIV alone, no? Na may
Siya complications na
yes,
siya.
na complication, na infection, opportunistic
Opportunistic
infection
infections.
sa mata, sa mga baba nila, no? Na ay mga lungs, nga pneumonia. So, natay mga infectious disease specialists on board, pulmonologists, even surgeons. Kay actually, cancer has a higher prevalence in HIV AIDS nga patients. Yes. And then, so we have grown to be more than 20 plus of us already in Kaambag. And also in the Visayas. So
Daghan na sa
daghan
taong
na.
hubs at 20 in
Yes,
this is
in
for the
several-
entire
yes, Central Visayas alone.
Okay.
Oo.
That's a good number already for inanib. So base sa gi-share ni Doc Kitkat nato no na I think the government has done its part in providing
Yes.
basic services, not even basic kay ni-expand naman ta into interdisciplinary nga kuan sa complications or kanang other kuan sa HIV, and it's all for free. Ang ato na lang yung buhaton, if in doubt, just visit the Kaambag Hub at Vicente Soto and have yourself tested. If it's negative, hallelujah. If you're positive, I'm not saying don't worry, but there's a treatment.
Yes.
There's a
There
treatment.
is hope.
There's hope. There's a
Yes.
treatment. Just have yourself treated, and take the program so that life is not the end of thing with this kind of sickness. So,
Yes.
Doc, magnadyo kay cheerleading group din si Lay Espinosa, go Doc Kathleen del Carmen. So, nag-watch ni sila karon. Si Chris Ann Mahusay Abadias, I'm not sure if they're part of the 20 in Kaambag. Go Doc Kitkat from Kaambag family. So, thank you for watching. Si Jen Branzuela, shout out to Doc Kathleen Joyce, complete name yung kaayo Doc Kitkat, from Kaambag Clinic Family, Vicente Soto Medical Center. Si Jocelyn Peliazo, go Doc Kitkat, pedia doctor from Kaambag Clinic. So mga proud family members ni Doc Kitkat sa Kaambag sa Vicente Soto. So thank you for watching. And my last question will be,
okay.
What role does comprehensive sexuality education in schools play in preventing new HIV infections, especially among the young people? Di pa din siya last. Napakilay ko Sige.
Of course, knowledge is power. And knowing about HIV, how it is transmitted, how you can protect yourself, or if you have it, how you can treat yourself, is a critical step towards your own entire health. So, as early as a child can understand these things, as that we are open to discuss it, no sugarcoating, really presenting facts. I believe there is a kanang good unsa ni kanang uh, good decisions. It will empower them make good decisions nga, of course, they know that they can get it through sex, through this drug use, no, IV drug use, and so they will uh, not do these things. And of course, there is still hope if they already have it. So na they can it's there are welcoming hubs around each areas, very welcoming, no, our staff.
No judgment.
No judgment, because we really want to empower testing, prevention, and of course treatment for those who have it. So if by an early age that it is already discussed to them, then they can take the necessary steps to protect themselves.
Kani siya, from the schools, kay sa kuan man to sila, how can families and communities better support children living with HIV to reduce the stigma and improve their quality of life pod?
Yes, because of course na may uban nga stigma pa, no, although it's better now. If it becomes part of our normal conversations, even just part of a normal testing process, consider it like a CBC. No, when you get sick or you have you're scheduled for a surgery, okay, let's get tested. So when it gets part of our system, we
Part
will
of the checklist.
checklist na okay, it's
You have to
just
do
really
it.
part.
Oo.
Then it reduces the stigma also. So this is just not just for families to really start conversations with your children, but for also us health practitioners nga, we empower our patients that, hey, you can get tested. You want me to include this in your test? Because this test, with our law, it has to have consent. So when you make it a part of a routine type of test, then it reduces the stigma and empowers people to get tested.
Yeah, so, pero klaro kayo ang message ni Doc Kitkat, no, that for us to be aware of kanang positive baka or negative is just have yourself tested, and there are free testing centers like the Kaambag in Soto, so don't be afraid. I know it takes courage if you're in doubt, but it's better be safe than sorry. So thank you kaayo kang Doc Kathleen Kitkat del Carmen for explaining and sharing her insights, and thank you to our viewers who shared their shout outs to Doc Kitkat. So see you again next Thursday for another episode of Vital Signs. I'm Mildred Galarpe.